Hello everyone, welcome back to my channel. So in this video I'm going to discuss about the electrical conduction system of the heart. So guys, in the last video we have already discussed that what is heart, what are its chambers. So we have already discussed about this is like heart. So it have four chambers, right atrium, right ventricle, left atrium and left ventricle, and about the aorta and as well as the pulmonary arteries. So for this one, that how this mechanism work, so that will we will make the different separate video for the coronary circulation. So just a simple quick tip. So for electrical system of the heart, you know that how heart functions electrically. So you all guys know that we do the diagnostic test called ECG, right? So why this ECG test is done? To detect that how heart is functioning electrically. So in today's lecture, we are going to discuss about how heart is functioning electrically, okay? How the impulses are being transferred in. So similarly, for a quick example, we can say at your homes, you know that we have some electrical, channels at our home as well. The electricity is conducting because we have those, supplies at the home which run the electricity at your home, right? If you have laundry or a dryer at your home, they work by electricity. Same thing, the heart is having in this whole electrical system, like from where the electrical signal will travel step by step to we can say to maintain the complete distribution of blood flow among the heart and through the rest of your body. So okay, so let's get started. So guys, heart have always, we can say, sorry, I'll just rub this. So heart have uh, some nodes you can see here, and cells and some muscles. So these are the three things which are responsible for contraction of the heart and relaxation of the nerves as well. So this contraction and relaxation mechanism controls your heartbeat and your blood flow through the whole body. Okay, if this system will not work properly, how the system will work? When the signals will travel through. If the signals will not travel properly, or they will not function properly, then your heartbeat can be abnormal. Your body will not have the proper distribution of the blood. So I hope that's pretty much straightforward. So let's get started for the flow chart, that how the electricity travels in. So in this diagram we can see that this is SA node. This point is SA node. So guys, just make sure that your SA node is known as pacemaker of the heart. Okay, pacemaker of the heart means it generates the excitation signal. So first signal come from SA node. Okay, so in this diagram we can see, so your sinoatrial node, it's your heart's natural pacemaker. So it sends the electrical pulses that start the heartbeat. SA node is in the upper part of your heart's right atrium. We can see this is your heart right atrium. So it is at the edge of your atria near your superior vena cava. So here comes your superior vena cava. So all this, it's nearby this one. So vein that brings oxygen poor blood from your body to the heart. In my last video we have discussed that superior and inferior vena cava brings deoxygenated blood. Then your autonomic nervous system controls how fast and slowly your SA node sends electrical signals. This part of nervous system directs hormones that control your heart rate based on what you are doing. For example, your heart rate increases during exercise, and it slows during sleep. If you are doing any exercise, it will go up, and if you are sleeping, it will go down. So these all are controlled by your autonomic nervous system. Now some of you are thinking that what is autonomic nervous system? So autonomic nervous system has two categories. Sorry, I'm just going beyond the topic, but just for your clarification, it have sympathetic nervous system and it also have parasympathetic nervous system. So sympathetic nervous system means fight or flight response, makes your SA node work faster. Okay, so it will tell your SA node that hey, run. Okay, so your SA node will run and it will make your heart rate increase. So sympathetic means it will start fighting, right? So it will fight along with your we can say it will tell your SA node that run, and then heart rate will get increased. Similarly, if we talk about the parasympathetic nervous system, it means rest or digest. Okay, sorry. So it will say, I'll just drop that for you. So what is parasympathetic? Means it will say to your body rest or digest response. So of course from this we can see that it is resting, so that makes your work SA node, that it will say hey SA node sleep. So SA node will sleep and then that will decrease your heart rate. Okay, so this was this is known as your autonomic nervous system, in which these two categories fall. Okay, so so SA node, the autonomic nervous system will then, this way autonomic nervous system will control your SA node, which will first send the excitation signal. So first signal comes from the SA node. Then we have the impulses pause for 0.1 second, right? Like the electrical signal is generated, then signal will pause at the AV node. You can see this is the AV node. Okay, so AV node, you can see AV node connects, this is your atrium and this is your ventricles. These the AV node connect right atrium to the right ventricle. Okay, so we can see the AV node delays the SA node's electrical signal for how many seconds? 0.1 seconds. Then it delays the signal by a consistent amount of time or a fraction of second each time. So this delay ensures that your atria are empty of blood before the contraction. So you are thinking that, okay, the signal is started from here and then it holds the signal for 0.1 second. Why does it do that? So that your atria can properly be empty, right? So your AV node is located in your area. So we can see here, so it's connecting atria and ventricle, right? So this is your central of the heart. We can see this is the area where there is center of the heart, right? Then so we have your bundle of his. So just note guys, just listen carefully, then we will make a flow chart which will explain briefly that how the channels are being transferred step by step. So bundle of his is also called atrioventricle bundle. Okay, so we can see this is your bundle of his, right? So it is a branch of fiber, or we can say nerve cells, that extends from your AV node. We can see this is extending from your AV node. So this fiber bundle receives the electrical signal from the AV node, and this bundle of his will carry the signal to the Purkinje fibers further on. Bundle of his, have the left bundle branch and the right bundle branch. Okay, so we can see on your right side, so heart is always opposite in the diagram. Okay, so don't get confused. On your right side you can see there are left bundle branches, and on your left side you can see there is right bundle branch. So we can see that left bundle branch sends electrical signals through the Purkinje fibers to your left ventricle, and the right bundle branch send electrical signals through these Purkinje fibers, these thread-like fibers, to the right side of the heart. Okay, so you know Purkinje fibers are branches of specialized nerve cell. They send electrical signals very quickly. Okay, very quickly they do their job to the left and right ventricles. Your Purkinje fibers, you know, they control the ventricle walls. Okay, so this is about, you know, the conduction system of the heart till now. So now I will just help you to, you know, make some chart for that how the electrical system works. Okay guys, so there is some flow chart which you can just note it down, or you can just click a picture for your reference. And then moving forward, I will just explain this flow chart in your diagram, that what it does, so that it can make a clear picture in your mind. Okay, so let's see. First, this is your SA node, where first the electrical system or impulses will generate. Okay, so this is known as pacemaker of the heart. Then impulses will go to atrioventricle node. Okay, so this atrioventricle node, we can see here the AV bundle connects to the right atrium, to the right ventricle, right? So here after the signal reach AV node, here the signal will get hold for how many seconds? For some fraction of second, we can say 0.1 seconds. Okay, so this literally works very fast. So this AV bundle connects atria to ventricle, where the signal will get hold. Okay, then we have bundle branches conduct. So we can see these are the bundle branches, right? So this is your bundle of His. So bundle of His will pass impulses to your right bundle branch and left bundle branch. Okay, so after AV node, it will hold the signal for some fraction of second. Then bundle of His will generate that signal to these right and left bundle branches. Okay, and then we can see after the left and bundle branches, the signal will be carrying here. These are your Purkinje fibers, which are your nerve cells. So these will stimulate the contractile system, right, of both the ventricles. Okay, so this is how, you know, the signal just travels so quickly, right, and it will generate that electricity. And these four steps are followed, right? So this will, you know, this is responsible for your contraction and relaxation of the heart. So if this system doesn't work properly, so what can happen? So first, there can be arrhythmias. Okay, so arrhythmias will occur, right? So that means your heart rhythm can be irregular, right? So it will be irregular, or we can say abnormal, like atrial fibrillation. So we will be discussing in other videos. Then if your bundle branches are not working properly, then there can be bundle branch block, right? So maybe if right bundle branch is not working, so this right side will not work. Okay, so that will cause arrhythmia. And it can also cause the heart block. So impaired electrical signals, if your atrias are and ventricles are not sending the signals properly, it can also cause the heart block, right? And so I'll just write it over here. It can also cause the heart block if atrias and ventricles doesn't flow very well, right? So then we have is your PVC. What is PVC? That is premature ventricle contractions. A too early, like I'll just write here, premature ventricle contractions. So what does that mean? A too early heartbeat in your ventricles causing heart palpitations, or in simple language we can say skipped. So it's skipped heartbeat. Like, so it can be very too early, right? Or there can be fourth condition, which is also called as sudden cardiac arrest. So this was all about your, electrical conduction system of the heart. If you have any questions, just let me know in the comment section. So there are only 4 steps which needs to be, followed, which are your SA node, then AV node, then the signal, just delay for some seconds, and then your bundle of His will, distribute the signal toward right and your left bundle branch, and then to the Purkinje fibers, which will then stimulate the contractile nerve cells of the heart, which will contract. Okay, so these are some conditions, like if it will not work: arrhythmias, heart block, premature ventricle contractions, and your sudden cardiac death. So pretty much straightforward. So that was all about the video. In our next video, now I'm gonna discuss about preload, what is afterload, the coronary circulation. Okay, so stay tuned and thank you for watching.